In recent years, there's been an increasing number of clinics offering stem cells and plasma treatments to fix a lot of things, including damaged joints. The question we're asking today is this really a safe thing to do?
Joining us around the table right now with a look at some of the research and related to easing arthritis is Dr. Sabrina Fabi. Let's first explain kind of what this treatment is with stem cells and plasma.
Yeah, so 31 million Americans have some form of osteoarthritis, which is inflammation of your joints. 700,000 end up going through a knee replacement because of it. And now, since life expectancy is increasing, patients usually have to do a second surgery. And so in an attempt to avoid surgeries, people have been looking and seeking other therapies like stem cells. But stem cells are a little difficult in that they're poorly regulated. And stem cells doesn't mean the same everywhere. So you can get stem cells from a variety of sources, like you can get it from your own bone, or you can get it from your fat, or you could even draw blood and get it from your platelets. So there are many different sources of stem cells, so it's not all the same.
So what's the idea of why you would want to do that? Like, is there a health benefit to using stem cells or plasma?
So stem cells is where our body is able to create and regenerate new cells. And so many of these stem cells can become new skin, or can become new heart or liver, right? So they have a large regenerative capacity. And as we get older, those stem cells also get a little bit older. So you're always looking for younger stem cells, which is why there's been so much popularity in getting umbilical cord, because there is a rich supply of youthful stem cells there, with the hope that it would regenerate cartilage that is wearing down in joints if you injected it there, or in bone if you injected it there.
All right, so help us understand this without taking us to medical school
Yes.
here. I mean, because it's so interesting, because we've heard the term stem cells for a long time, but what does that mean? It's a cell that can grow into many different kinds of cells,
right,
and therefore fix a lot of different potential things.
Perhaps stem out, if you will.
Stem out.
I will.
Or potentially decrease the inflammation. And that's the point, Andrew, we don't know. So when you inject it into the knee, it might regenerate new cartilage, but there's also bone there. So it potentially can regenerate new bone. And the problem there is that you have bone on bone arthritis. So could you be making the problem worse down the road? We don't know. We also don't know if it's just the anti-inflammation that those stem cells create that perhaps is causing a decrease in the symptoms. So it's not regenerating anything as much as it is decreasing the inflammation.
We've been talking about this for it feels like at least a decade, right? Maybe 15 years or so. This has been kind of part of the conversation. Are we really still early in the research and understanding what we can do with it?
There are more and more companies. Now the FDA actually has a registry, so it's encouraging companies, because they say that they won't necessarily regulate anything that is homologous. So that means that if you decide to take your own stem cells from your bone and you inject it in yourself, they don't have any business in that. But they do have a business in how that blood and how that tissue is handled. And now that we're actually looking into taking stem cells from like umbilical cord or other people's, children, their placenta, then there is concern. And so the FDA most recently sent out 45 different warning letters, because there are many labs out there popping up and they just handle stem cells however they want to handle it, because there's no regulation on how they should be handled. And so if you get stem cells from one person, they might have a very small concentration. If you get it from another person, you may have a high concentration, and all these things do play a role in the ultimate effect.
So I would say just keep doing your research at this point. If someone recommends this would be a good treatment for you, maybe just come at it with a little leery.
Make sure the company has been around for a while, that they're credible, because you also don't want to get any diseases like we saw from that one case in New Mexico where they were passing on HIV.
Right, yeah, definitely don't want that. All right, Dr. Sabrina Fabi, thanks for being here. Appreciate it.
Thanks for having me, guys.